Hi there, Allison.
Hi.
My name is Joanne. I'm your nurse, and I've come in to show you how to use inhalers today.
Okay.
Can I get your last name and birthday, please?
Rapoyo, and I don't know my last name. I know I'm 7 years old.
Oh, okay. Can I look at your name tag here? Or
Sure.
what's on your wrist? Perfect. Okay. So 1920, or 40. I'm just going to look at my MAR here. Yep.
Okay.
You are the right gal for me.
Great.
Okay. Do you have any allergies to any medications? Let's look at that too.
Don't think I do.
Just penicillin, so that's it. And there are no problems with the medication that's in here. So today we're going to be doing what's called a meter dose inhaler.
Okay.
And this is because you have asthma
Mm.
and COPD. So you're having some troubles breathing, aren't you?
Yeah, a little bit.
This is
I thought my son was taking care of this. So.
Yeah. Well, we're going to show you how to use these today so you can help yourself too, okay?
Okay.
So this is going to help open up your airways so you don't have so much difficulty with breathing, okay?
Mm-hmm.
There's two different medications in here. This inhaler is actually called Symbicort, and there's two medications in here. One medication is the dilator, which is going to open up the airways, and then there's another medication in here. It's a steroid, and that's for the inflammation that you've been having because of the COPD. So this medication is something that you're going to use every day.
Okay.
It's not going to treat it. You're always going to have the asthma and the COPD, but this is going to help manage your symptoms, okay?
Okay.
So you don't have those big flare-ups all the time. This is going to help you stay steady so your breathing is okay. Okay?
Okay.
All right. So we'll go through, there's some different methods that we're going to teach you today, and we'll find out what's best for you. All right? And if you have any questions along the way, let's just go ahead and ask them. We'll track back anytime we need to. So any questions at all, just feel free to ask.
Is there any... If I use it, is anything going to happen to me?
You could. There are some side effects to this. Since there is a steroid in here, thank you for asking that. There is a steroid in here, and it could make you feel a little bit jittery for a while.
Okay.
Your heart rate does go up a little bit, but if it goes up a lot to where you just feel like you can't breathe and shortness of breath, then we want you to talk to a medical doctor, okay? Because that could signal an emergency or what's called an anaphylactic reaction. So if you have a lot of difficulty with breathing, or you feel like you can't catch your breath, make sure you call your healthcare provider, because it could be an emergency situation. But with using these, generally you just have a little bit of jitteriness, like your heart rate goes up a little bit because of the steroid in there. And that's normal, and it does go away after about 20-30 minutes, okay? So we'll go ahead and go through the different ways that you can use this.
Can't my son just manage this? He comes and sees me at least twice a day.
I can certainly show him how we do this as well. I can show him, go through all the steps with him. So if you do forget, or if you need help with it, then he knows too what needs to be done, okay?
Great.
So you can actually pull this out of the canister. It shows you what the expiration date is. Always look at your expiration date, and your pharmacist will help with that as well. It expires in 2020, and you see that right there. It also shows on the box how many puffs you can have, and this one is for 200 puffs. Since we're taking it using it 2 times a day with 2 puffs a day, that's 4 times that you're going to use it. And since there's 200 puffs in each can, this should last you about 50 days. So it's important to not overuse this. Don't use it more than what's recommended or what's prescribed by your doctor, okay? Because you could build up a tolerance to it.
Okay.
And then it doesn't work anymore.
Wait, what's a tolerance?
So tolerance is you use it, but your body just doesn't even work with it anymore. You've built up a tolerance to where it's not enough. Okay? Do you understand what that is?
Yep.
Okay. So don't overuse it. If you miss a dose, don't go ahead and do a double dose on it. So don't go and take 4 doses of it, because you could really get that reaction of irregular heartbeat and because of the steroid in there. So if you miss a dose, just wait until your next dose is due.
Okay.
You're going to be taking this 2 times a day. So let's go ahead and go through this. We're going to do a couple techniques. One is called the open mouth. One is called the closed mouth, where you put your lips around it. So they're basically both the same. One is just that you put your lips on it, and one is that you don't. We'll do the open mouth technique first. Okay. So you take this off, your little cap off, okay, and you're going to shake it up. I'm just going to demonstrate this here for you, okay?
Okay.
You shake it up about 5-6 times, get it all mixed up together, And then you're going to put your thumb here on the bottom and your fingers on top, and you're going to do what's called priming. That gets it ready. Okay, you're always going to prime it. Or if you drop it on the floor, or if you haven't used it for a while, always prime it, okay? Hello. How you doing?
I'm great.
Okay, so we've primed it, right? We shook it up, we primed it. Let's put our fingers right here. It's going to be 2 finger widths apart. See that? And then we're going to take a nice deep breath in and exhale. And then when we put this up to our mouth again, we're going to push this at the same time that we take the nice breath in, okay? So put it up there. Take a deep breath in. Relax it. Put it up to your fingers. Pull the fingers away and take a deep breath in and press at the same time. Hold it in for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release it out of your lungs. So you have a nice, good breath in. It's getting into your lungs. It's staying there for about 10 seconds, okay?
Okay.
So once we do that, we wait for a whole minute in between. Okay? So say it's another minute in between, and we're going to do it one more time because we're going to take 2 puffs, right?
Yep.
So another open mouth. Shake it.
Shake it.
Put your fingers up to your mouth. You don't have to prime it this time because it's already primed, right? We have one.
Yep.
So shake it. Put it up to your fingers. Pull your fingers away. Take a deep breath in and push the lever at the same time. So hold 10 seconds. 7, 8, 9, 10. Release. And you're done. Now, the really important thing with this is, since there's a steroid in here, always, always, always rinse your mouth out with water afterwards, okay?
Well, why?
Because with a steroid, it's in our mouth. It's medication in our mouth. The lining in our mouth can grow like an infection or like what's called thrush, like hairy black tongue thrush, bad stuff. So
That's so gross.
Yes, it is. And so and if you get something like that, then you have to use another medicine for that. So always rinse your mouth out. Do not swallow the water because you don't want to get it down into your stomach. So take some water in your mouth, gargle, and spit it out. Okay? So that's one way to do it. The other one is just with the closed mouth technique. Same thing as what we just went through, but you're going to be putting it around your lips. So let's go ahead and do that. Shake it. You have your fingers here, and you have your thumb here and your fingers here. Shake it 5, 6 times. Prime it. Put this on your lips now, okay? Take a breath in. As you practice, exhale. And then the next breath you take in, you're going to put your lips on it, and you're going to press it at the same time as you take a breath in, okay? So let's try it. Hold for 10 seconds again. 2, 3, 4, 5, 6, 7, 8, 9, 10. How are you doing so far?
That's a long time. I don't know if I can do that.
Hold it as long as you can, okay? Even if you can't hold it for 10 seconds, hold it as long as you can. Not more than 10 seconds, and just to get that good breath in, okay? We want to open up those air spaces and take down the inflammation in there so you can breathe better. So the longer you can hold it, up to 10 seconds, the better off you're going to feel, okay?
Great.
So then we do that again. We go through that whole thing again, okay? Now the other technique that we have that is really cool, that you really want to pay attention to, which is cool, this is called a spacer. A spacer is so you don't have to push this at the same time as you take a breath in. You can kind of have a little bit of a delay, so you don't have to be so coordinated, basically.
That might help.
Yeah, so basically what we're going to do is shake it up again, just like before. We're always going to shake, we're always going to prime, right? Shake it up, prime, put the spacer, see that little hole there? Put the meter dose inhaler into that hole there. This is what, oops, get it on there, good. This is what you're going to breathe out of, okay? That's what you're going to put your lips on. So it's shaken, it's primed, and now we'll take our breath in, practice breath in. And then what you can do with this one, you can push the button, put your lips on, okay? So you don't have to do it at the same time. So we took our deep breath in. And we push it. Take a breath in. Hold 10 seconds. Let it out.
Okay.
And then we do it again.
Perfect.
2 times. So, same with this. What do we always do after we...
Wash our mouth out.
You remember why?
Infection, I think.
Yes, infection, so we don't get that infection in our mouth, okay? So now with this, you're going to want to wash this out each time.
Okay.
Because you want to get that medicine out of there as well. Just like you want to get the medicine out of your mouth, you want the medicine out of here as well. You don't want it sticking in there for the next time, okay? So you can pull these pieces apart.
Can I wash it out with soap?
Just use warm water.
Okay.
You don't need soap on it.
Okay.
So just pull these pieces apart and wash it out. Nice warm water. Put it on a cloth and let it dry. Okay. Until you're ready to use it again the next time.
Can I just stick it in my purse with me if I remember it? After
you wash it out really well. If you don't, you can carry it with you in your purse after you wash it out. Make sure it's dried out really well. If you really want to carry it in your purse, you sure can.
Okay.
But if you could remember to do this before you leave in the day and when you come home, that'd be great. It's spaced every 12 hours in between, so... But if you want to carry it, you can sure carry these with you, okay?
Okay.
Just make sure that these get cleaned out really well. Really important thing, always wash your mouth out with water afterwards. Don't swallow it. We want to get rid of all steroids in our mouth, okay? Very important. We also have what's called a powdered dose inhaler, where we use capsules on it. And some people do like to use those as well. Basically, all that is we put a capsule in a little tiny container. We break the capsule and you suck on it really hard. The thing with that, though, it doesn't work as quickly. Like these work more quickly than an actual powdered dose inhaler. So depends on what your doctor wants you to have. And it looks like he ordered the Symbicort for you today. Do you know like what would work best for you? What do you think would work best for you?
Probably the spacer dealio
thing. The spacey dealio thing? Okay. You can get these at your pharmacy, and I can talk with your son about that as well. And he can help with that. I will also go over these directions with your son, okay? So you don't feel so worried about it.
It might help.
And then also I'm going to print out some paperwork, step-by-step process of this and how to do it. So if you feel like you get lost, you can always go over those steps too.
Great.
If you have any questions, you can sure call.
Okay.
And we can help you with that. Also, your pharmacist can also help you with it. So you have lots of people that can help you if you get worried or get nervous about not being able to use it correctly. Trying to think of anything else that I could go over here with you. Do you have any questions at all?
No. Just make sure my son knows about it too, just so that I don't get confused.
Okay. And what's
forget it.
Can I get your son's name?
Michael.
Michael, okay. Do you have his... Well, I can look for his phone number. Is it in the chart?
He's out in the waiting room waiting for me.
So I can talk with him about that.
Sure can.
Okay. I'll definitely go ahead and do that. And if he wants to learn about this as well at the same time, I can give him the instructions on that. Let me get some paperwork here for you.
Okay.
I'll get that printed out. I'm trying to think of if I'm missing anything here. So yeah, you might feel a little bit jittery when you use this, okay?
Okay.
And that's to be expected. That does go away. Don't use it more than you should.
Right.
Just as what your doctor says.
Okay.
It's a Symbicort. Make sure you wash out afterwards. Wash your mouth out really well, okay?
Okay.
And let's see, what else? Yeah, I think that's about it.
Great.
So you want your spacer.
Yep, I'll go and grab one of those.
Okay. If you have any questions at all, there's information here on your printout too as well.
Great.
We can help you with anything, okay?
Great.
All right. You have a good day.
Thank you.